Looking for relief from incontinence? Watch this video to know about natural methods for prevention and treatment. If you or someone else in your family suffers from incontinence, you are not alone. Yes, you heard it right. A lot of people find it difficult to talk about it, but it's estimated that half of all women suffer from urinary incontinence in their lifetime, and even a lot of men have trouble with their ability to control their bladder or bowels. Urinary incontinence, which means the inability to control one's bladder, is a common and frequently embarrassing issue. The intensity can range from occasionally dribbling urine when you cough or sneeze to having a sudden intense urge to urinate before reaching a restroom in time. Many different factors can contribute to incontinence, such as childbirth and pregnancy, illnesses like diabetes and infections, as well as lifestyle habits like smoking and drinking alcohol excessively. Types of incontinence. There are 4 main types of incontinence: stress incontinence, urge incontinence, overflow incontinence, and functional incontinence. Stress incontinence is caused by weak pelvic floor muscles or damage to the sphincter muscles. Urge incontinence is caused by overactive bladder muscles or an obstruction in the urinary tract. Overflow incontinence is caused by a blockage in the urinary tract or a problem with the nerves that control urination. And functional incontinence may be related to medical conditions such as Parkinson's disease, dementia, stroke, diabetes, or Alzheimer's disease. There are many different causes of incontinence, including weak pelvic floor muscles, pregnancy and childbirth, obesity, menopause, and certain medications. In some cases, incontinence may be due to an underlying medical condition such as a urinary tract infection or neurological disorder. Taking measures to prevent or treat these underlying conditions can often help relieve symptoms of incontinence. Measures that might work in the case of a urinary tract infection include drinking plenty of fluids. Neurological disorders that cause incontinence include multiple sclerosis, Parkinson's disease, stroke, dementia, and diabetes. Here is what you need to do. If you have diabetes and experience frequent urination at night or increased thirst during the day, it could be one symptom of diabetic nephropathy. So I suggest you to contact your doctor right away. For those with Parkinson's disease who experience difficulty controlling urine flow, their doctor may prescribe medications like anticholinergics, which work by preventing contractions in the bladder wall. What you can do about it? There are a few things you can do to ease the symptoms of incontinence and even prevent it from happening in the first place. First is to maintain a regular schedule for bladder emptying. Make a habit of going to the washroom on a regular basis rather than waiting for the urge to go. Excess body weight can also cause urinary incontinence, so make sure you maintain your body weight in the normal range. Your pelvic floor muscles weaken when you strain to pass stool, which worsens the urinary incontinence problem. Never ignore a bowel movement. Make a habit of clearing your bowels daily in the morning. The most efficient and natural approach to emptying your bowels may in fact be squatting or sitting with your legs slightly spread out. Making changes in your food and lifestyle may be helpful if you suffer from constipation. Increased fiber intake and exercise levels can be of great help. Be sure to stay hydrated by drinking plenty of fluids throughout the day. It's easy to drink lots of water when it's warm outside, but not so much when it's cold. Just remember to keep yourself well hydrated no matter what time of year it is. Pelvic floor exercises, for example, Kegels exercise, helps to strengthen the muscles that support your bladder. Watch my video on Kegels exercise, how to do this exercise, and much more about Kegels. But if you have already tried Kegels and searching for an alternative in this video, don't worry, I've got you covered. You can try Clamshell exercise, which is also a very effective exercise for pelvic floor muscle strengthening. The link to both these videos are in the description below. Another alternative to Kegels is a side step. To do a side step, all you have to do is squat down while standing with your feet shoulder width apart, step with your right foot out to the side and then bring it back to the starting position. Repeat the same with your left foot. Next is to avoid trigger foods and drinks that may irritate your bladder or make you have to go more frequently to pass urine. If you liked what I explained in this video, click on like and share it with everyone you know. Subscribe to my channel and hit the bell icon to get notified every time I upload a new video. That's all for this video. See you in the next one. Till then, watch the videos in the description about Kegels and clamshell exercises and don't forget to do them. None of it works unless you do them regularly. I've done my part of giving you the knowledge. Now you have to do your part. If knowing is half the battle, action is the second half of the battle. Bye-bye. See you in the next video.